Hello everyone, welcome to Dr. Lee's Evidence-Based Integrated Medicine, a place where Asian wisdom meets modern science. I'm your host, Chi Chen. In this episode, I would like to share with you what I know about magnesium. Magnesium is one of the most underrated supplements. Living in the modern world, multiple factors limit us from meeting the daily requirement of magnesium intake. I often mention that one of our health issues we are facing is the pandemic of magnesium deficiency. So in this episode, I would like to talk with you why magnesium is important for our bodies, why nearly half of the Americans do not get enough magnesium from the food sources, and my personal recommendation. With a summary of the clinical indication, I will present in a separate episode, which will release concurrently with this episode. Magnesium constitutes the fourth major cation in our body. Approximately 2/3 of the body's magnesium is stored in our bones, while the remaining 1/3 is found inside our cells. Only about 1% of the body magnesium is present in the bloodstream or bodily fluid. This is why it can be challenging to determine if somebody is magnesium deficient based solely on the blood magnesium levels. The body often compensates for the low blood magnesium level by releasing magnesium from the cells or bones, making low blood magnesium levels as a late manifestation of magnesium deficiency. On average, we should be consuming around 400 milligrams of magnesium from our dietary sources. However, most Americans only get around 300 milligrams per day, which is 25% less than the recommended intake. Magnesium is subject to secretion in both urine and stool. Our kidney plays a vital role in regulating magnesium levels, responsible for reabsorbing 30% up to 95% of magnesium back to our bodies. So it's important to exercise caution when considering magnesium supplements, especially in patients with kidney disease, as they may have difficulty excreting the magnesium in the urine. On the other hand, individuals who have been on long-term diuretics like furosemide, namely water pills, may require magnesium supplements to compensate for the magnesium loss through urine. What are some functions for magnesium? Magnesium serves as a cofactor for approximately 300 enzymes in our body. Enzymes are essential for carrying out various functions, and magnesium's role as a cofactor is to enhance the efficiency of those enzymes. Magnesium also plays a crucial role in DNA-RNA repair as well as electrolyte transportation. In addition, it maintains a close ties with connective tissues, such as muscles, nerves, and blood vessels. In my opinion, I consider magnesium-rich foods or herbs to possess this earth's energy in the traditional Chinese medicine concept. They form the foundation of our energy systems and contributed to the overall strength and vitality. When it comes to chronic disease, magnesium plays a role in addressing inflammation and oxidative stress. While magnesium may not boost the strong anti-inflammatory or antioxidant properties on its own, insufficient magnesium levels can leave the body vulnerable to develop disease associated with chronic inflammation. So what's causing this widespread magnesium deficiency? One of the significant factors is demineralization of our crops. In modern agriculture, we commonly use synthetic fertilizers, which often lack essential magnesium ions. Some of them contain high concentration of potassium, which could inhibit the absorption of magnesium ion by plants. The irrigation practice and acid rain can further deplete the magnesium content in the soil. While our plants have less magnesium, the food processing methods can further deplete magnesium content. For example, when we boil our food, we can lose anywhere from 50% to 70% of magnesium content. Furthermore, during refining and processing, 95% of magnesium can be lost, leaving us with products that are far less nutritious. Lastly, medication and aging can interfere our body's ability to absorb or retain magnesium. This graph illustrates the evolution of calcium, magnesium, and iron content in vegetables from 1914 to 2018. What is particularly striking to me is how these mineral levels has declined by up to 8-fold over a span of century. When we refine grains or strip away the outer layers, such as in the case of white rice, we end up losing a significant portion of essential fibers and micronutrients. This makes brown rice a superior choice from a nutritional perspective. Processed white flour, while undeniably delicious, can be categorized as calorie-dense and nutrient-deplete option. It lacks the essential nutrients that are found in whole grains. Boiling depends on temperature and cooking duration can indeed lead to nutrient loss. So we should be mindful of our cooking methods, which can help us to preserve the nutritional quality of our meals. How about medicine? In March 2011, the FDA issued a warning regarding the long-term use of proton pump inhibitors like omeprazoles, which commonly prescribed for the treatment of gastric reflux or peptic ulcers. So we already know some of the adverse effects of proton pump inhibitor PPI, such as osteoporosis, pneumonia, and ulcerative colitis. This warning highlights the potential association between long-term PPI use and decreased magnesium level in the body. So what are some of the group of patients that are at high risk for magnesium deficiency? Elderly population who have reduced gut absorption, people who consume high percentage of processed foods, people who are taking medications such as proton pump inhibitors or diuretics, people who have been consuming alcohol or substance abuse, lastly, people who have an underlying history of inflammatory bowel disease or post-bowel surgery. So those are the groups at high risk for magnesium deficiency. Okay, let's talk about requirement, food sources, and assessment of nutrition status. So what is our daily requirement of magnesium? The recommended dietary allowances, which is RDA, for magnesium can vary by age and gender. For adults, the RDA typically fall within the range of 310 to 420 milligrams per day. For the memory purpose, we just remember for adults like 400 milligrams per day. When it comes to food sources, the general rule is to include more nuts, grains, legumes, and dark green vegetables in our diet. Meeting the daily requirement for magnesium isn't a daunting task from both a financial or technical standpoint. It simply requires us to be mindful for our food choices. The good news is that many magnesium-rich foods are not only nutritious, but also delicious, like edamames, cashews, and pumpkins. How to determine if you are magnesium deficient or not? Unfortunately, there is no single lab test that is both accurate and flawless. Blood magnesium levels tend to drop only when the body is severely depleted, while the RBC magnesium level reflects the body magnesium more accurately. The test is not widely available. Urine magnesium tests and IV magnesium challenge tests can also be time-consuming. So how do we assess whether a patient requires a magnesium supplement or not? I would say I will take a holistic approach. I evaluate the risk factors, dietary habits, medication use, medical history, and any symptoms that could contribute to magnesium deficiency. This comprehensive assessment helps us to guide the decision whether magnesium supplement may be beneficial. So what are some symptoms of magnesium deficiency? Symptoms of magnesium deficiency can manifest in different ways. Some individuals may experience neuropsychiatric symptoms such as depression, anxiety, irritability, or headaches. Muscle cramps and palpitations can also occur in those with magnesium deficiency. It's important to note that many medical conditions and metabolic imbalances can also produce similar symptoms. So therefore, if you have those above symptoms and you suspect yourself having magnesium deficiency, it's essential to seek guidance and diagnosis from medical professionals. There is no enough evidence to suggest one preparation is superior to the other. So generally, we have a different kind of magnesium products in the market. Magnesium oxide is cost-effective and has been studied extensively. However, the drawback is that it could lead to diarrhea. Magnesium citrate, while some studies have indicated that it may have better absorption compared to magnesium oxide, while in my experience, it can often result in strong dietary inducing effect. Magnesium glycinate have a lower likelihood of causing diarrhea, but is slightly more expensive. So how to choose the product depends on your clinical indications and what are your personal conditions. If you are dealing with constipation, it may be a good idea to consider magnesium oxide or magnesium citrate. However, if you experience occasionally bowel issues, it may be worthwhile to opt for magnesium glycinate. In terms of the caution and contraindications, I would like to accentuate that we should exercise caution when giving magnesium supplements to patients with kidney disease. Hypermagnesiemic periodic paralysis is a rare disorder wherein giving magnesium could lead to weakness. Another contraindication is for patients who have myasthenia gravis. Magnesium supplementation is contraindicated. And my take on magnesium. Magnesium is one of the most underrated minerals crucial to our health. Several factors put us at the risk of magnesium deficiency. It is an inexpensive supplement with minimal side effects. But caution is advised for patients with chronic kidney disease. If dietary magnesium intake is insufficient, I might, based on the individual situations, consider magnesium supplements for patients with the following conditions. First one is the risk factors for cardiovascular disease, such as diabetes and hypertension. For patients those taking diuretics or proton pumping inhibitors in long term, patients experiencing anxiety, stress, or headache. Preferably for those patients that it's beneficial to take those supplements at bedtime. Or individual taking calcium supplements because calcium and magnesium usually contradict to each other's. Lastly, for patients who are dealing with constipation. In addition to increasing fiber, I think magnesium is a good option for constipation as well. Okay, thanks for your attention. We are going to record a separate episode for the clinical indication of magnesium supplement. I will present evidence-based medicine in this video as well.